As a content engineer, I write the standards for NCQA's accreditation programs. My role is to really highlight the various feedbacks that we get from direct patients, from providers on the ground delivering care, and from payers who are ultimately paying and reimbursing for the care. But it's also critical to think about the regulators in this space and how NCQA can align our policies with the federal and state regulations. NCQA standards development process requires consensus building, as NCQA is an organization that is meant to bring transparency and accountability to the healthcare space and to organizations who deliver care in various settings in the healthcare space. So it's important that in my role writing standards, I receive feedback from not only the direct customers of the accreditation programs, but ultimately who would benefit from these accreditation programs, which is the patients. When we're creating standards, we get feedback from various sources. NCQA is a consensus-driven organization. And so with that, we're getting so much feedback from various stakeholders, and the way that we really filter through that feedback is to, one, ensure everyone's voice is heard, and two, to really deliberate on how can we meaningfully incorporate the feedback. And what that process includes is NCQA has a host of panels, committees, and various advisory bodies to really help us internally digest that feedback. And from there, they help us think about how do we introduce a glide path? How do we help organizations along their journey? How can we help organizations to really paint the picture of where they're at in terms of their quality implementation? And specifically with virtual care, the way we built the standards is thinking about organizations who are on different parts of the healthcare journey, because we don't want to limit organizations who are maybe newer to the industry, are not as formalized in their policies and their processes. But then we also want to ensure organizations who have been established in the field can receive the recognition. And at the end of the day, all organizations are working for the greater good in healthcare and ensuring patients can get better care. Approaching accreditation can seem very intimidating. However, the way that NCQA has really taken a deeper look into not just how we're creating the standards by involving stakeholders from the beginning and even throughout the whole entire process, from when we have our initial idea to when we have some draft standards and to the final version of the standards. And it's one thing to put out a quality accreditation program, but if we're not providing organizations with the right support and tools so that they could be successful in their accreditation, we're really missing the mark. And so that's an opportunity that NCQA has really invested in. And we are very intentional about the education and support tools and resources that we provide organizations who are going through the standards, the requirements. It really provides a framework for how they want to achieve their goals today, tomorrow, and for the future.